My research is really around patient and community engagement in healthcare and in primary care. I got to this path also as a resident. I helped start a patient advisory council at my residency at Cambridge Health Alliance in Boston. And it was so amazing to partner with patients kind of across the traditional hierarchies and really talk about quality improvement. How is our clinic perceived? How are our equity numbers for our patients? And it was so transformative. But when I went to the research, to the literature, I found nothing. I found there was no real precedent literature to discuss the evidence base for patient and community engagement in primary care. And so I very reluctantly, because I had similar experiences to Hunter as far as not thinking I was going to do research, very reluctantly looked at research fellowships and was able to talk with Kevin and really learn that the Center for Excellence in Primary Care was focusing on patient engagement at the time. And so that's really launched me on this path, very unexpected. I also did the primary care research fellowship um, and really worked on patient advisory councils. And so I'll just share my research mission and career mission is I am here to transform healthcare spaces into vibrant, community-led, participatory practices that promote wellness and justice. And so how that looks currently, two examples is we're working with our patient advisory councils, who are an amazing group of English and Spanish speaking folks who are now actively part of the residency interview process and helping to select select who are the doctors that will then lay hands on their bodies and do medical care for them. And then another example is a community engaged process for digital support and navigation to help bridge the digital divide and reduce racial and ethnic inequities that we've seen really blossom and exacerbate during the pandemic. And that's come from community, and it's with community kind of all the way through. And it's been really gratifying.